Hi all you fabulous Foobs. Welcome to another episode of Foobs and Fitness. When you're facing any type of cancer diagnosis, doctors are equipped with so many different tools to help fight this disease. But which tool is best for you? In this episode, we'll be explaining the difference between two very popular tools that are used in the fight against cancer: chemotherapy and immunotherapy. When people say they are or have been through treatment for cancer, you probably think, oh, they went through chemo. That very well may be the case, but there's also a different type of treatment called immunotherapy that's also used. Both of these treatments have the same end goal, but take extremely different approaches in how they actually get there. Let's first talk about what a cancer cell actually is. A cell that becomes cancerous is not like the other cells that we have within our bodies. These particular cells divide at a rapid rate while often mutating and wreaking havoc on our immune system. Chemotherapy, aka chemo, kills these fast-growing cells, but unfortunately, it can't differentiate between cancerous and non-cancerous cells. Immunotherapy, on the other hand, helps your immune system do its job better. It helps your immune system recognize cancer cells more easily and kills them. Both treatment styles can be used by themselves or in combination with one another. They might also be used in combination with other forms of treatment, like radiation. Please know that this video is not to be used as medical advice. This is an educational video to explain the differences in treatment styles and help give you some background on what your team may advise for your specific treatment plan. Now let's get into these treatments just a little bit further. Chemo drugs work while being administered through an IV, pills, or even creams, and it remains in the body for a certain amount of time, which gives it more of an immediate effect. Immunotherapy, however, works by stimulating your own immune system to continue attacking cancer cells long after treatment has ended. This usually causes the effects to take place over a more extended period of time. How do each of these treatments really work, though? Well, chemo travels through the bloodstream to reach cancer cells, or it can be directed towards a specific area of the body. It works by disrupting the cell replication process during different parts of the cell cycle. This means that when the cells are trying to split or divide, chemo interjects and says, "Not in my house." This is actually classified as a systematic approach and has been around for a long time. It's also an extremely effective way of preventing cancer from reoccurring. Immunotherapy is an entirely different beast. These types of drugs are created to help the immune system become better at detecting abnormal cells. They're able to do this in a few different ways. Firstly, there are checkpoint inhibitors, which are designed to disrupt the signals that cancer cells send that trick the immune system into thinking that they're actually healthy cells. Think of this as if you were underage and you're trying to get into that nightclub or bar. You would use a fake ID to pass off as someone that you're not in order to reach your end goal of getting inside. Cancer does the same exact thing. However, these checkpoint inhibitors are like bouncers. They've got a scanner to reveal whether or not your ID is in fact legit. When these bouncers realize that the ID is fake, they trigger an immune response that attacks these cells. Next, we have cytokines, which are specific protein molecules that are created in a lab and then injected into the body at a much larger dose than what we actually produce naturally. This helps regulate and direct the immune system to work harder at killing these abnormal cells. The best way to think of this as like your immune system getting a jolt of pre-workout and is just ready to crush some PRs. Then there's a small but mighty category called CAR T cells. This little guy is a groundbreaking type of cancer therapy. T cells are known as infection-fighting white blood cells and are developed from the stem cells within our bone marrow. T cells are extracted from the patient's blood, modified in a lab to attack specific features of the cancer cells. Then they're returned to inside the body. These modified T cells are then referred to as CAR T cells. I'm going to use one of my favorite action heroes for this analogy. Deadpool was injected with a mutation-activating serum that caused his superpowers to awaken within him. CAR T cells are just like microscopic Deadpools running around your body killing cancer cells. Lastly, we have cancer vaccines. Yes, this is a real thing. There are vaccines out there that reduce the risk of even getting cancer in the first place by attacking the viruses that can cause cancer. The most widely known form of this type of vaccine is the HPV vaccine, and it was first recommended in 2006. The human papillomavirus, or HPV, is a sexually transmitted infection that can lead to cervical cancer, as well as many other types of cancer. When the vaccine is given before you're ever exposed to the virus, it can prevent most cases of cervical, vaginal, vulvar, and many other types of cancers. This also applies to a first-of-its-kind vaccine for triple-negative breast cancer. It's currently undergoing clinical trials as we speak. Please know that immunotherapy is still very much evolving, and the treatment effectiveness is only available to some patients with specific types of cancers. Not everyone is going to benefit from immunotherapy, whether it's on its own or combined with chemo. When talking to your team about what your treatment options are, hopefully this video will allow you to become more immersed in what they're actually doing for you. Make sure you're asking questions to your team if you don't understand something, and know that there may be options out there. Make sure that you're subscribed to my channel so you don't miss any new episode notifications. New episodes are aired every Wednesday at 3 p.m. Eastern Standard Time. Make sure you like this video, and I'll see you next time. Keep being a badass.